Hey James, what are you doing?
I'm getting my knees healthy. What do you think I'm doing?
Join us today on the 50 Shades of Pain show where we're going to talk about
Knees.
Hi, I'm Dr. Donish, Medical Director of Wellward Medical here in Lexington, Kentucky, and I'm here with my co-host, Dr. James Escaloni.
That's me.
And this is the 50 Shades of Pain show where we empower our community by talking about pain and demystifying both physical and emotional pain to help you optimize the best out of your biology and get the best out of your body. So today we're talking about
Knees.
knees.
Yes.
And knees are one of the more common arthritic joints in the body. And it's because we think of it as a very simplistic movement. It's just a bend.
Well, door hinge, right?
Right.
Just a door hinge.
But it's actually quite a complex joint because it's involved not only in moving your knee, but also stabilizing your ankle. Knees are not only involved in hinging the literal knee, but it also is involved in twisting your ankle. And there are actually 4 bones that come together to make up your knee. And each of them are really integral in making the stress distribution even in the knees. But if you notice, most of us, when we stand, we're standing with wider hips than where our knees are positioned in space, which means that the inside part of our knees often get a lot more stress. The other big part is that this bone out here called the fibula, it's a tiny little bone that runs on the side of your leg, that stabilizes the main strut system. And a lot of times that can start to get wiggly and wobbly as you age, and that causes more stress on the knee itself, which will end up with arthritic changes.
Now, one of the things that a lot of people are not aware of is that there's multiple layers of protection around these joints here. And so one of the things that happens is as we are younger, we have all sorts of events that we have. We have things like our MCL that's on the inside of your knee. It's really common, and we see it here all the time, that somebody will have some old injury to their MCL, and you know what? The body is amazing and it heals wonderfully, and that scarred down just enough so they're fine. But the problem is, multiple layers of protection that were there, now there's a little bit less of a layer of protection. And what does that end up causing over time?
Yeah, so over time, as the scars within that ligament, they will break down faster than the original ligament does. And as those scars start to break down, that old injury that took place when you were a teenager playing soccer or football or some other athletic,
Wrestling.
can then show his kids are big wrestlers. They can show up later in life as that scar breaks down, it actually resurfaces as an instability. And it's those instabilities that cause pain and subsequent arthritis.
Yeah, if you guys at home are trying to think about this, imagine some sort of big wall and you try to knock it down with a wrecking ball, all right? They'll think about how easily that's gonna go down. Now, if you have 4 walls in a row, now try to take that wrecking ball through there. It's gonna be harder and harder for those walls to fall. That's like your knee when we're young and have all those layers of protection. Well, if we start to lose those over time, well, those things can break down, and just like the walls can break down easier if there's only 1 wall versus 4 walls, same thing with developing things like arthritis in your knee, because these little things aren't there anymore. So does this mean there's no hope for anybody who has these injuries on their knee?
Not at all. So I'm gonna give you 3 tips on how to preserve the functionality of your knee as you age. Number 1, if you have an injury, make sure to get some really good rehabilitation for that, because one of the purposes of rehab is to stress structures in the direction of forces in your body enough to where those scars don't actually form. And if you can get the appropriate kind of rehab early on, then that issue might resolve entirely and never leave a mark that could subsequently or later in life become a problem. Number 2, stay physically fit and active. If you can stay active and fit, even those old scars can remain viable and healthy because you've got other structures around it creating more strength. Kind of like that wrecking ball analogy, you can put up more walls in order to protect your body from getting down to that scar. And number 3, don't sit on an injured or painful knee too long. Like if you had an old injury and now it's resurfacing, don't think it's just going to go away because it did the first time. That, especially as we age, our capacity to repair and layer down new healthy tissue as opposed to scar tissue becomes less and less and less. And so if you're a teenager and you injure your knee, it's very different than if you're an older adult. And I would qualify myself and Dr. Escaloni in that category. Anybody over the age of 35, it's more probable that you're going to have a lingering issue because your body's capacity for repair is slowing down. So treating that early, it's an ounce of prevention prevents a pound of cure. A lot of times the cures are massive surgeries, whereas the prevention could just be some simple injections and exercises and things.
I think we have a fantastic story with what you guys did with me. All right, if you guys got an opportunity to look back on some of our earlier shows, we had some in which I had a chronicling of my own knee pains. And after looking back on things, I waited way too long to get a little bit of help. But to be honest, I just didn't know what to do, and I didn't know what options were available.
And you're a smart physical therapist.
I like to believe I am.
And this was still a gap in your knowledge base. So we're always in the capacity of learning. And it really wasn't until collaborating and understanding each other's realms did we understand, oh, you can do this and I can do that. And together it makes so much more of an effective team.
So to catch you guys up, I had this knee pain that was crackling and hurting, and I was not going to be able to do as much of my weight training that I wanted to. I was starting to have problems going up and down stairs. I couldn't participate as much with my kids' wrestling coaching or Brazilian Jiu-Jitsu. I love doing that. And these started to get worse and worse and worse, despite me doing a lot of quality exercises, following a lot of the first couple advice items that he gave to me and to you guys. But what happened is after we did a diagnostic ultrasound, we were able to find that some of these deeper ligaments were in fact torn and injured. And so I got lucky and he was able to do a good prolotherapy injection. Watch the video, it's comical, right? Because it's me and I'm like so nervous about how bad it's gonna hurt, and it wasn't that bad. But then after getting that done, I was able to start squatting again. We were able to actually see that the joint was more stable. And I was able to do a lot of these exercises following tips 1 and 2, and it had more of an effect because now there was a better stability of the joint. And this is something that I am not going to wait for myself anymore. The second I feel any sort of little itching of pain down there, a little tingle of something, oh, I'm coming right back here ASAP. I'm not going through 10 years of suffering when it's just 10 minutes of relief after this.
Yeah, I think we've all had that. Even I've done that on my own knee. Similar issue, different ligament. But yeah, those old injuries can creep back up on us for sure.
Definitely. So guys at home, if you are thinking about this and it hurts just a little bit, it's beautiful outside, you want to start doing more things, gardening, running, exercising, all of those things, but you think that any sort of pain is getting in your way at the knee, come on by. We'll be able to find this so easily, doing some diagnostic ultrasound so we can figure out where exactly the problem's coming from. It's one of the best physical examinations you're gonna get, one of the best injections that you'll ever receive, nicest ever, and a good looking guy too, giving it all at the same time.
Even though, as you say, aging.
Aging, yep. Yeah, so you guys, it's well worth it. You should definitely do that if your knees are bothering you.
Yeah, and if you found this video helpful, please comment and give us any questions or feedback. We'd love to hear from you to give you better information and really educate our community so that you can take the best opportunity in advancing your health as much as possible.
All right, well, thank you guys for coming. And for the 50 Shades of Pain show, I'm Dr. Escaloni.
And I'm Dr. Donish. We'll see you next time.